Well, good morning. Thank you, partners, for being here, our community partners, our nonprofit agency partners, our media partners. I'm Chris Ronayne, Cuyahoga County Executive. I want to thank University Hospitals Health Systems for having us here today at the Ahuja Women and Children's Center. Love this facility. When I worked just down the street in University Circle, we had always hoped that our anchor institutions would make it to the neighborhoods to meet people where they're at. That's exactly what UH did with this Women and Children's facility. So thanks to our partners at UHHS for all you do, and all our partners here today. This will be a somber report today, but it's an important one that we will remain committed, dedicated to making the change we need to make for the most vulnerable in our community, and that's our kids. So here today, many of my partners will be presenting not only findings in the 2023 Child Fatality Report, which is something that Cuyahoga County delivers every year, but today I think you'll see at the end of a difficult report a renewed spirit to collaborate on solutions. So as difficult as the news is, we want you also to focus on what's possible. Thank you again for being here to address a deeply troubling issue, the release of this year's Cuyahoga County Child Fatality Report. Thank you to the members again of the Cuyahoga County Child Fatality Review Board, led by Board Chair Katie Parker of Bright Beginnings, for your work to review the causes and the circumstances surrounding a child's death. There is no more important work in our community than to get to the bottom of what's affecting children and families in terms of their own well-being and wellness. This data is heartbreaking. It shows concerning increase in child deaths within our community. But our board is made up of professionals from various fields, including healthcare, law enforcement, social services, and public health. Many of them are in this room today, and they remain committed to provide solutions in our community, working with our civic leaders and our neighborhoods and our residents to make change. Every number in this report represents a young life cut short, a family devastated, and a community impacted. The safety and well-being of our children must be our highest priority. They are our future, 100% of our future, and it is our shared responsibility to ensure they have the chance to grow and live full, healthy lives like we all hope for here in Cuyahoga County. This report underscores a stark reality. No single organization, agency, or person can solve this alone. You're familiar with the village concept. It does take a village. It will take all of us, county leaders, community partners, health experts, and families, working together to create solutions that protect and uplift our children. That's why today I'm joined by Shawna Rohrman, Director of Invest in Children, Dr. Roderick Harris, Cuyahoga County Board of Health Commissioner, Dr. Thomas Gilson, Cuyahoga County Medical Examiner, Celina, Cunanan, University Hospitals Chief Diversity, Equity, and Belonging Officer, Angela Newman-White, first-year Cleveland Executive Director, Jazmine Long, Birthing Beautiful Community CEO, and a member of the Cuyahoga County's Women's Health Commission. There may be others that will join us at the podium, and we thank them for their partnership. And I want to pay a special thanks to Patty DePompe, who's not with us today, but she is the president of University Hospitals Rainbow Babies and Children's Hospital and the McDonald Women's Hospital, for leading her the charge that she leads for change for children, women, and families in our community. Today is about more than sharing the data. It's about recognizing the urgency of the problem and committing to action. It's about collaboration and identifying resources, addressing gaps, and ensuring that every child has the support and protection they need. We will shout out to other partners throughout the state of Ohio and frankly the nation to say our Cleveland kids, our Cuyahoga County kids need you. Our families need you. I salute the many nonprofits that work with us every day to make the lives better for our families and our children in our community. As we move forward, I urge everyone here to think about what role they can play in this critical effort. It takes all of you. Whether it's advocating for policies and programs, supporting families, or simply being a voice for the most vulnerable, every action matters. As we like to say, if you see something, say something. Thank you for joining us today and for your dedication to our children. We can and must create safer, healthier communities for all. Those who are going to speak are going to introduce each other, and I'll come back for closing remarks, but I'd now like to introduce Director Shawna Rohrman, Cuyahoga County Invest in Children Department, who will go over the data. She's been with the team for many years, and this team celebrates 25 years of work protecting the most vulnerable at age 0 to 5 in this community. As they come up one by one and introduce one another, again, I want to say thank you and hats off for the work you're doing to make the change that we need in this community. And I appeal to all in Cuyahoga County to lend a hand, to pitch in for the betterment of our children. Thank you. Shawna.
Thank you, Executive Ronayne. As he said, I'm Shawna Rohrman. I'm the director of the County Office of Early Childhood and Invest in Children. Invest in Children is the county's early childhood public-private partnership serving the needs of families with young children from birth through age 5. In addition to many other services and programs, Invest in Children administers the Child Fatality Review Board that is required of all Ohio counties. This is done in close and long-standing partnership with the Cuyahoga County Board of Health. The Child Fatality Review Board brings together professionals from various fields, including healthcare, law enforcement, social services, and public health, to review the causes and circumstances surrounding a child's death. By learning the story of the child's life and the circumstances of their death, the board aims to uncover challenges the child and family faced, the systems they interacted with, and the risk factors that may have contributed to their death. Central to this process is the attempt to spot where better intervention and risk reduction could have combined to prevent that death. The death of every child under the age of 18 gets a review by the board, but special emphasis is placed on conducting case reviews of any death that was unexpected or preventable. For 2023, more than 75 in-depth individual case reviews were conducted by the board. These case reviews are independent of and in addition to investigations done by the Cuyahoga County Medical Examiner's Office, whose rulings help inform the review process. Each year, the data that stand out are those types of deaths where there were meaningful increases or decreases from the prior year, because they tell us where more effort is needed or where prevention programs are working. Using data to inform systems change is a key part of prevention, and that is what underlies our reason for sharing the following data this morning. It is sobering, but it's our hope that the data can help drive broad community awareness and increased cooperation to ensure that we can recognize and act upon every opportunity to prevent a child's death. In 2023, 190 children under the age of 18 died. Tragically, this is higher than the 10-year average of 174, and it is 38 more than in 2022. Most of the increase is attributable to deaths in just two categories: infant mortality and child homicides. Infant deaths are often described as a barometer of the health of a community, and by that measure, we have much more work to do. After 3 years of successive drops in our county's overall infant mortality rate, we're very concerned to see a substantial increase in 2023, particularly among Black infants. 112 infants died last year, up from 91 in 2022. Those 112 deaths translate to an overall infant mortality rate of 8.8 in the county and a Black infant mortality rate of 15.9 in the county, each of those higher than the previous year. The data suggests that an increase in the number of babies born prematurely was the primary reason for this increase. Child deaths due to abuse and neglect also increased substantially. In 2022, we saw 11 children die because of abuse or neglect. Last year, that number increased to 18. This spike comes after 10 years of relatively stable numbers, about an average of 8 per year. It is deeply concerning to see a noteworthy increase above the average in a single year. Finally, we saw a significant increase in child homicides. Last year, 34 children died by homicide, up from 23 the year before, which was already a 10-year high. The driving factor was an increase in homicides of younger children. The presence of fentanyl and/or other illicit drugs and drug use in the environment was a risk factor found in many of the case reviews of child homicides. In 3 of the homicides of children under age 10, acute fentanyl intoxication was the cause. Illicit drugs were a factor in nearly all adolescent homicides. The full Child Fatality Review online data dashboard presents many additional points of current and historical information. I encourage you to check it out. Our partners at the County Board of Health have made it available and easy to use. I would also call attention to the printed executive summaries that we've made available today. It is our solemn obligation to let the data inform how we can do even more to ensure every child in Cuyahoga County has the chance to grow and thrive. That whenever possible, they have a childhood free from disease, injury, despair, or violence at the hands of another. We have effective systems and programs in our community, you're going to hear about those today, to reduce these deaths. Many of the folks running these programs have a seat on the Child Fatality Review Board, but as long as one child dies a preventable death, we should be doing even more. I'd like to call up Dr. Harris, our partner in this work, Commissioner of the Board of Health for Cuyahoga County.
Good morning. Again, Roderick Harris, Health Commissioner for Cuyahoga County Board of Health. So I would like to first start by thanking our staff here at the Cuyahoga County Board of Health. I have a lot of our team here, members of our population health team, also our epidemiology, surveillance, and informatics team. And thank you, County Executive Ronayne, for allowing us to discuss such a challenging topic and making sure that we have an opportunity to embrace one another as we approach this work. So to address these injustices, and that's what I call them, I think we have 4 things that we must do. And the first thing is really acknowledge the problem. We have a problem here in Cuyahoga County when it comes down to our child fatalities. And the CFR, the Child Fatality Review, allow us to do just that. These data that we see, they stare us in the face every day. Here at the Health Department, we make sure that not only we're looking at these, but also that we're doing whatever we can programmatically to drive change. As we think about this as our community, I think we should think about these children as our own children. Let's think about the dreams that we have for our own children and how those dreams can be deferred for other families. There are so many families, there are so many individuals that these dreams have turned into nightmares, and we can't forget them, and I hope that this report gives us an opportunity to look that dead smack in the face. The second thing we need to do as we deal with any health-related issue is think about how we diagnose the problem. And I think that this review board also does that by showing us the data around these preventable deaths. These data show us that policy changes need to happen, programmatic changes need to happen, and simply our current reality is not matching up with our preferred future. There's a gap, and I implore each of us to do what we can to make sure that children are our collective responsibility. These children are future parents, future grandparents, future community leaders, and whatever else they might want to do. But in public health, we look at upstream approaches, and what can we do to keep these children from becoming victims to these premature deaths and preventable deaths in the first place. So what does that look like? That looks like us making sure that people have access to care and treatment, making sure that we individually and collectively reduce barriers to this access to care and treatment. That might include addressing racism, discrimination, and bias in our organizations and within ourselves. We also need to make sure that we minimize exposures to toxins, chronic stress. That's something that we definitely experience in a lot of communities that are underserved, but also these unhealthy behaviors that plague our communities. Lastly, I want to mention that we need to make sure that we have nurturing environments. Those environments can be educational, it could be social, it could also be physical environments. But how can we do our parts as an individual or even as an organization to make sure that we're nurturing those around us, especially our children? I know as a Black boy growing up in Cleveland that those things made a difference in my life. Growing up in Cleveland, I also was a Cleveland School graduate, and I understand that there were programs, whether those were Upward Bound programs or even just mentors that I had in my life, that made such a difference, and I think we should do everything we can to make sure that everyone has that opportunity. As I wrap up my remarks, I would like to say that I want us to honor each of these children that we lost in 2023, and make sure that we do the fourth step, which is energize one another. As County Exec Ronayne said, we each can do something, and we should take that as a responsibility, no matter how small our role could be. These deaths should not be in vain, and I would say that, again, like County Exec Ronayne said, this is a community-wide issue, and it will certainly take a community-wide response. So thank you. Up next, we have Dr. Gilson.
Thank you, Director Harris, and thank you, Executive Ronayne, for drawing attention to this report, which is very sobering, as the executive said. Little background, the Child Fatality Review is a multidisciplinary group that meets monthly. It's hosted at the medical examiner's office, and I look at myself here today as a representative of the folks who have been, donating their time on a monthly basis to try to understand pediatric deaths and to try to specifically look at things that are preventable and how we can look at systems, not individual stories, potentially to fix situations. I'd be very remiss if I didn't thank two people in my office, Mike Shadler, my senior investigator, and Dr. Caitlin Weaver, who we newly hired, who has specialty training in childhood diseases, and who's going to become my partner, trying to address a lot of these problems, which are very chronic and not new. They're just alarmingly on the rise. I'd also like to acknowledge the folks at the Board of Health who've helped out, particularly Holly Galicki, who is, I think, largely the author of this fine report, and Katie Parker, who chaired our board for the last year. Please read this report. I can't stress enough, that the couple minutes I can take to draw attention to different things really are just scratching the tip of a very, very complex social problem. And as the executive said, I think the issue is that children's health is really a harbinger for a lot of other things that are going on within our community. So when he and I meet monthly to talk about things, the intersections of other things we're talking about, gun violence, poverty, mental health treatment, are all related to what's in this report. I'm going to touch on a couple of those things and try to address some of the approaches that come out of the Child Fatality Review and out of the reviews of these tragic, tragic deaths. I mean, these are children who really never get a chance to grow up and live a nice life like, I'm looking around, we're mostly adults in the room, like we got to live and we get to live. These are mostly preventable deaths. I don't think that, these are things that necessarily are incurable, and I'd like to touch on one of those things at the end that, where we've made some progress in 2024. But I think that they require a sustained effort on our part to address the underlying issues that make these deaths possible and also that make these deaths preventable. I think one of the numbers that was touched on earlier by both speakers and the executive is the staggering increase in homicide deaths. These are primarily related to firearms, and they're primarily young African American men. I would say we could call them probably, males, because some of them are nothing more than boys. And sitting in these reviews and seeing the background that gets to this point, these aren't people who just get, off the trail on a given day. These are preventable, long-standing social issues that wind up with a very tragic exclamation point to a life cut short. I think some of the things that we can talk about and are trying to study about are, where does the education fit into, these children? Do they stay in the school system? Would mentorship make a difference? Where do the guns come from? Who owns them? How do they get into our community? And are they involved in other criminal activity? These are things that we really, unfortunately, don't have a lot of knowledge about, but I'd like to change that. Suicide is another, I think, hiding in plain sight problem, in that the incidence of suicide among minority youth in the United States has been on the rise for at least 10 years. And if that shocks you, it's a disappointment to me, because it isn't hiding in plain sight that this is a reality. And why do we have that? Traditionally, suicide didn't affect, teens at the same rate that it did the elderly, didn't affect minorities at the same rate it affected, white population. What's changing? These are fundamental questions, and I think some of the things, that I touched on already about firearms certainly are intersectional to addressing suicide as well. The last thing I want to touch on, just because I could talk a very long time, and I don't think that's really why we're here, is one of the things, though, that I'm pleased was positive that came out of our child fatality review is that we had identified an increase in drowning deaths. And they really represented two classes. We had, toddlers in the suburbs who were basically wandering into unsecured or not fully secured swimming pools and drowning. And an inner city, young, primarily male African-American population who would drown because they did not know how to swim. That's unacceptable in a city that offers free swimming lessons. We need to get out messages like that. And I'm pleased to say that this is one of the accidental deaths that trended in the right direction in 2024, but was definitely a bellwether in 2023. And I like to use that as a springboard to say that these problems are not unfixable. In fact, they are fixable if we understand the problem, develop the solutions, and work as a team to implement the solutions. And I know our next speaker has done stuff at the University Hospital, who are a great partner to us too. That's Celina Cunanan.
Good morning. My name is Celina Cunanan. I'm the Chief Diversity, Equity, and Belonging Officer for University Hospitals and also a certified nurse midwife who has been privileged to catch babies in this community for 23 years. I also chair the Commission on Minority Health for Governor DeWine. I want to thank Patty DePompe and all of the work that she has done to allow us to do, to help us, to challenge us to rethink care differently. And the things that I'll talk about are a lot attributable to her lasting legacy in leading this organization. As we know, a healthy pregnancy is foundational not just for the mother and the child, but for the health of the entire community. However, achieving healthy pregnancies goes beyond clinical care. It requires us to address the broader social drivers of health that significantly impact expectant mothers in our region. We know that actual healthcare delivery only impacts patient outcomes by 20%. We know that 80% of patient outcomes are affected by the context in which people live, work, and play, and includes things such as food access, housing, economic stability, education, transportation, and lived experiences. Nutrition plays a vital role in a healthy pregnancy, and we at University Hospitals are doing our part to help ensure that expectant mothers have access to healthy food. Our clinicians screen all patients for food insecurity, and those who screen positive are referred to our Food for Life markets. Healthy food and one-on-one guidance from our registered dietitians, free of charge. Through November of this year alone, our 3 Food for Life markets in Cuyahoga County, at Otis Moss Health Center in Fairfax, at Cleveland Medical Center, and at our Community Wellness Center in Glenville at the Davis Apartment Homes, have provided food to over 4,131 unique individuals, many of these women and children. Limited transportational, financial constraints, and access to providers are real-life issues that can lead to inadequate prenatal care. We are breaking down some of these barriers by offering healthcare close to where women live. Through Rainbow Connects, our social needs navigation program, we have provided navigation services to more than 50% of families who walk through these doors. Here at the Rainbow Ahuja Center for Women and Children, we centered the voices of our community in reimagining what healthcare could look like and are proud to offer unique programs such as Centering Pregnancy, led by our certified nurse midwives, where women due at similar times could go through prenatal care visits together and receive enhanced education and support right in this room. Research shows that women who participate in group prenatal care models like this have a lower chance of preterm birth, lower birth weight, and postpartum depression, and are most likely to breastfeed. In our pediatrics department, Healthy Steps launched this year, a national program which provides intensive support to families with children 0 through 3 years old to make sure they meet their developmental milestones. The Rainbow Center prioritizes the patient experience and strives to provide complete wraparound services for women, including access to midwives, physicians, nurses, community health workers, dietitians, legal aid, pharmacy, lactation counselors, mental health services, vision, dental, lab, and ultrasound. Eliminating barriers to care reduces stress for pregnant women, which we know can lead to preterm birth and other poor pregnancy outcomes. And yet we still know that we cannot provide all the services that are needed for every woman. We cherish our long-standing relationship with Birthing Beautiful Communities to provide doula services to clients and the additional social support and holistic care that our patients need and deserve. As a healthcare institution, we continue to do our part in providing evidence-based compassionate care to all, while also reinventing our healthcare delivery models to address social needs. We do also understand our responsibility to train our workforce from the inside out so that all patients are listened to and treated with dignity and respect. Our caregivers must understand the unique challenges that some of our patients face, and it is crucial that they are equipped with the knowledge and cultural competence to care for the many diverse communities we are privileged to serve. As part of this priority, UH is excited to announce the launch of Team Birth, an industry standard process to improve communication, teamwork, and shared decision-making throughout the birthing process, giving every person a chance at a safe and dignified childbirth experience. Team Birth will launch at all UH birthing hospitals beginning in 2025. No one organization, whether it be government, healthcare, or community-based, will be able to move these mortality rates on our own. It will take all of us collectively in the region, whether you are in healthcare or not, to support women and families. We are appreciative for the ability to work alongside the organizations that are represented here today and are grateful for their continued partnership, leadership, and support. And with that, I'd like to introduce Angela Newman-White, the Executive Director for First Year Cleveland.
Good morning. As Celina mentioned, I'm Angela Newman-White, the Executive Director of First Year Cleveland. I'd like to first thank the support of the County Executive's Office, the City of Cleveland, the philanthropic community, and the State of Ohio's Department of Medicaid, and the Department of Children and Youth for their support in allowing us to operate as the county's collective impact organization, working in partnership with community to not only drive and enhance our robust programmatic services, but also to hone in on key policy opportunities that are going to address the larger social context. All of the speakers before you did effectively mention and talk about the overall impact of the social conditions that our families are living in our community. These social conditions has translated into symptoms that are required to receive what we call treatment through very effective programs and services, many of which that are also represented in this room. First Year Cleveland is proud to be a proud supporter of Birthing Beautiful Communities, Village of Healing, Pregnant with Possibilities, Moms and Babies First, Moms First. I mean, there's a ton of organizations that we support, but we have the unique position of listening to our organizations working directly with communities and identifying opportunities to fill gaps within services, but then also pursue those larger policy and systems changes that are needed to create conditions to essentially cure the symptoms. What are the root causes? Understanding that sleep-related deaths is the most preventable form of death, we are proud to partner with Cuyahoga County and the Cuyahoga County Board of Health to launch Babies Need to Breathe. This is a comprehensive safe sleep campaign that not only includes community awareness and education, but is also indicative of data being collected directly from families who've actually slept with their baby. And really understanding what does it mean to implement alone on your back in a bare naked crib. That's very easy for some of us that have access to paid leave, that have a safe and healthy place to place our baby. But the reality is in the city of Cleveland, many families that experience financial burdens have less opportunity to place their baby or to adhere to these recommendations that we so actively provide. So First Year Cleveland is partnering with Collaborate Cleveland to enhance access to paid leave. We're so excited for the paid leave policies that have been recently implemented within Cuyahoga County and the city of Cleveland for our civic employees, but what are we going to do about our private employers? Can we make sure that whether you're working at McDonald's, Walmart, Starbucks, Amazon, that you can stay home with your baby for 12 weeks, that you have the opportunity to breastfeed your baby? These are examples of some policy and system changes that can not only improve the health and well-being of families, but also support families to follow the safe sleep guidelines. when we think about the larger social context, housing is a huge concern, not only in Cuyahoga County, but across the state and really the nation. We are proud that we have recently implemented what's called Healthy Beginnings at Home. This partnership with the Centers for Families and Children and Eden allows us to identify individuals with housing instability and actually place them in a house of their choice for 24 months. With the stress removed from having housing instability and the financial means to, where am I going to place my baby? We're excited that thus far we have effectively placed 7 women into a home of their choice, in the community of their choice. And this partnership has also been expanded with the Cuyahoga County Metropolitan Housing Authority, who has also kind of partnered with us to make sure that once the 24 months of housing support is complete, that these families will be eligible for vouchers. Our ultimate goal through a partnership with Tri-C and other educational institutions is to make sure that women, once they complete this program, are in a position to where they can afford their rent, so they're financially stable. The increase in 2023 infant mortality rate, we are looking at it from First Year Cleveland's perspective, but just thinking about what happened, what was so different. And we have to think about what happened after the pandemic. Right? So during the pandemic, there were a lot of financial incentives offered to families. And in 2023, the child tax credit went away. In 2023, the SNAP benefits got reduced to their normal installments. And in 2023, all of the tenant protections essentially went away. But the cost of everything went up. And when we think about the financial stressors for families, we need to be strategic on how we can ensure livable wages, affordable housing, and just to make sure that we do everything that we can to reduce stress, because stress and mental health are so important when it comes to maintaining your pregnancy to full term. So First Year Cleveland also has, I'll close with our public policy work on the upstream side. Our priorities are, of course, paid leave, maternal mental health, and increasing access to basic needs like diapers. And again, that's addressing financial barriers, ensuring that women have what they need to reduce stress, but then also, how do we protect all of our families during the pregnancy journey? I'd like to welcome one of our partners, Jazmine Long, President and CEO of Birthing Beautiful Communities.
Good morning, everyone. And I know this is somber information, but it's so important to really recognize what it means for collaboration in our community to actually get something done. So my name is Jazmine Long. I'm the president and CEO of Birthing Beautiful Communities. I also have the pleasure of serving on the county's Women's Health Commission, where we really are trying to look at the systemic structures that are causing these kind of poor outcomes. And I want to just touch on something that Angela said, because I think we think about all of the factors post-pandemic, but what we don't talk about often is the lives lost. The uncles, the great uncles, the aunts, the great aunts, the folks that were a part of the village and who would have been a part of the village, making sure that our families had support. Because we lost so much and because we just had to keep going and life didn't stop for those of us who are still here, we don't often sit with that. So those are the folks that would have supported mom and partner to be able to go to work and do the things that they need to do. And so we really do need to ramp up those kind of thoughts of how do we really wrap our arms around our families? And so often in our community, we think that things are back to normal, and so we don't need to be supporting or at the same level. But I think even now more than ever, the data is showing that we do have to think about how we continue to provide wraparound essential services to families who don't have what they needed before. And also recognizing that a part of the rise in some of these numbers is that, families had to go back to work. Those of us who were able to work from home 5 days a week are no longer able to work from home. And there are microaggressions and stressors that come along with that. And there are pressures and stresses that come along with just trying to make sure that your family survives. I'm a City of Cleveland resident. My house is a few blocks away from here, and I think about what it means to be in this community, right? As it's rapidly changing, as you see diversity and you see things come, but there are residents who have been here their whole lives who don't feel included. And so we really have to think about how do we take the ego out of our work, and how do we take it's about my organization being the best, the first, the this and the that, and really think about community ways to have an impact on the lives of Northeast Ohio residents, because this data is harrowing, right? But this is why families are stressed. This is why women are scared. This is why we even see in some of the data previously that we saw the infants who passed away were primarily boys, because black men are under attack sometimes, and mothers have that stress of like, what am I going to do with this child in this community? And we have to really live with that, sit with that, have those conversations about how we provide safe spaces. As I look to my colleagues Sabrina Roberts and Pam Hetrick and Celina and Angela and everyone that we work with, I am really invested in how do we make a difference collectively. And when we say collective impact, because I don't really often see true collective impact models in this community, how do we really have collective impact? Some of the work that we do with Commissioner Wills is around working with our moms, and I'll give some anecdotes. We work with every incarcerated African-American woman who's pregnant in the Cuyahoga County Jail. We provide full-scale wraparound services for that woman, for her family, and then whoever takes that baby home. And sometimes it's not mom or dad or auntie, uncle. We have a mother who took home her friend's child, who has 3 of her own, and who decided to just step up and be there for that family. Like, that is going back to what Chris said earlier, that is it takes a village mentality, which is our slogan. We have to step up and be there and be a support system for our families. And on the issue of mental health, we had a mom who lost her child, and she delivered at home. And we didn't realize she had the baby in the refrigerator for 6 months, until she felt comfortable sharing with somebody what was going on with her and other children in the house, right? Like, these are the things that she just couldn't wrap her mind around, what had happened to her, what her experience was, and also given the political landscape, what might happen to her because she had this happen to her. And so we are there to be a support system to provide mental health services through our program, Our Wellness Network. We have the Pregnancy and Infant Loss Committee, which supports parents who have lost a child, and really letting families know that it's okay to not be okay. We know that in the African-American community, and a lot of the work that is at the state level talks about stigma reduction. So we do a lot of stigma reduction to know that it is okay to receive help. It is okay to have had something happen to your child, and you need really a lot of support around that. And so when we see suicides increasing and we see gun violence increasing, we also know that these things are linked to poverty. And so as my colleagues have spoken about, we have got to think about how do we lift folks out of poverty in this community? How do we ensure that they have access to housing, food, just the basic needs of any one of us would want to have in order to make a difference, and not leaving the dads out of this process as well, because dads want to be involved, they want to be engaged in their children's life, and they want to have the support to do that as well. So it is such a multifaceted thing of what needs to be done. We deal with 900 families every year, and we will continue to grow and serve even more and more. But again, not everyone wants a doula. And so we have to think about how do we collectively work together to ensure that those families, those 111 babies that were not supported in the way that they needed to be, how do we reach them? How do we touch their lives? How do we provide support to them? And so I'm honored to be here today, because I think we are really, when you see numbers like this, it does make you, it lights the fire to really say, like, yes, we are pedal to the metal, we're working as hard as we can, but maybe we're not doing all that we can be doing. And so I think about our 3 healthcare systems. We live in a community that has world-class health care. And so we have to really partner and think about how can we come together and it not be a competition, and that it truly is collaboration. And I'm honored. We will continue to work with the Women's Health Commission to look at what our community members are saying, because again, this is my work is really focused on the 0 to 3, but we know this is 0 to the lifespan, because we have grandparents who are raising their grandchildren. We have everything in between. And so really looking at it from a high picture level is so critically important. So thank you to everyone for the work that we're all doing. I hope that we are not discouraged, because what one of my doctors said to me is that, like, imagine if we weren't all doing the work that we're doing. It would be even worse than it is now. So we are truly making a difference. We can't be discouraged by these kind of numbers, and we just have to keep working forward and thinking about how we move the needle forward to save the lives of babies and families in our community. Thank you.
Thank you, Jazmine Long, Angela Newman-White, Celina Cunanan, Dr. Tom Gilson, Dr. Roderick Harris, and Shawna Rohrman. Thank you for your partnership in the network that cares. And I want to thank everyone in this room, whether you're in front of the cameras, behind the cameras, every agency director out there, every staff person working to better these numbers. But they're not just numbers. It's been said over and over again today. They're names. So we thank you for being with us. I just was compelled to grab a couple notes as you guys were talking, because everything you said today is just so important to the effort. We need to turn the corner. We need to turn the corner And this today is a clarion call. It is difficult news today, this report, but it is a clarion call to do better and reach out to partners who can help us do better. Again, 190 names, not statistics. Read through this, and it feels like math. It's people, it's names, it's families, it's our community. So I want to thank the Child Death Review Board for the very difficult but very important work you do every day. Katie Parker, thank you for chairing us. And we will continue, and we will turn this corner. The essence of what was said today comes down to the social determinants of health. Everything, mental health, addiction counseling, housing, everything that was said by our partners. And we thank all of you who do dive into the social determinants of health. It's right, as Jazmine said, it's right around us. How are people next door doing? And how are they doing in relation to neighbors and communities next door? So we thank all of our partners for being here. A couple of people I also want to mention, our Department of Children and Family Services Director, David Merriman is here, and Jackie Fletcher, our Director of the Department. And thank you guys for being here. I see Jen Johnson out there with Canopy. Thank you. Many of these agency directors are just fighting in the trenches every day, but we need more support. I'd be remiss if I didn't thank, if he's still here, and even if he's not, Mitchell Balk from Mount Sinai Foundation, our partner who's always got his eye on this. Thank you, Mitchell. Philanthropy matters in this fight to help our kids and families. Example of that, we were just granted an award for a child wellness center from the Mount Sinai Foundation, and that adds to an investment already made by Medical Mutual and many others. But it's a $14 million facility that we have said we are going to produce for our kids who are most vulnerable and most needed. I also want to thank, and apologies media representatives for doing this to another media representative, but I need to thank publicly Caitlin Durbin for, I thought, the most important story of the weekend, but frankly of the year. It had to do with kinship care and adoption services and foster care, and there'll be more in a series. We asked our media partners, and I thank all of you for being here today. This is not a report to be put on a shelf. The reason we face you front and center, all of you, is because we need your help. We need your help to illuminate what's possible and also to obviously dig in on names, people, families. So much has been said already today, so many different variables, but it is a network of things that cause the stresses, that cause the strife in our community, that leads to death. It's also education opportunities. It's policy opportunities. I can pick a few. We need to continue to lean in on the terrible tragedy of gun violence in our community, of gun traffic in our community, guns ending up in the hands of young children. We need to lean in to the state and others. We need to lean in on the issues of opioid and the epidemic that's still with us. Fentanyl traffic through our community, as Dr. Gilson cited, it's been raging in this community for too long. We need to educate. We need to educate our families on the dangers that are in our midst. But we also need to invest in solutions. I'm proud to be a partner with Birthing Beautiful Communities as one example, a place that is saving moms and kids every day just around the corner from here with their doula services and the many other services that they provide. As was mentioned by Angela, we're proud as a county to invest in family leave policies that help our employees through the birthing process and to give them the dignity of that time with their young child. We implore every county business, everybody who can lend in on something like that and lean in on better policies for our families. So today will continue to be a difficult day in the headlines from this report. It's somber news, as every one of my partners has said. But the opportunities to educate with partners like you, to add value in a network that can produce better outcomes for our kids and families, we will turn the corner if we work at it together. I hope all of you do get a report. We'll see us if you don't have one, about every name and family that's in here under a statistic, but it's a name and it's a family. Perhaps most important, though, is the recommendations that come forth in this report. What are we going to do about the dire straits we're in with the numbers? These are 190 children with names and families, not 190 statistics. So today is a somber day. We commit to you at Cuyahoga County to lean in and turn the corner with our agency partners. I say to you over and over again, we have the best public-private nonprofit partnership in the land, and I mean that. But today's a clarion call to all do more. Thank you for being with us today, especially our media representatives who are here. Our area specialists are here to take your questions offline with, if you have them today, for any one of them. And lastly, thank you for all the citizens who are here today doing the heavy work in our community in front of me. Thank you for being that village. We need to grow it. Thanks again. And if you have questions, we'll avail. Thanks.